So this is another kitten from the litter, and as you can see, he's being a model bottle feeder. You can see his ears wiggling, which is one of the signs the kittens are latched. I can also feel that vacuum in the bottle, and if you look closely, there are bubbles going up inside the milk. And again, I'm not squeezing the bottle, I'm just holding it at this 45-degree angle, and the kitten's making the milk flow down himself. And we'll be able to tell when he's done because the vacuum in the bottle will be released and he'll probably back away. So this bottle, it started at 30 mils this time, and this kitten drank 15 mils of milk. So quite a bit more than his brother. And this is just gentle pressure. Just think of the pressure that the mom cat would be using to lick them. So you don't need to rub really hard, and if you don't rub hard enough, they won't go to the bathroom. So think of the pressure. And then this little guy from the same litter has a crusty eye, so we're gonna go ahead and warm compress it and open it back up again. This is a clean Kleenex in the clean water. And then we just gently hold it onto the eye. And you can see it's just starting to open back up. And you can see again. So this little kitten, also black and white. The other one had a shaved rear. This one has no shave mark. Had 15 mils. Light yellow urine, and was not interested in the wet food. And because he drank a lot of milk, and that quantity is actually a little, it's a lot for a kitten of this size, so I'm not gonna offer him any more, because if you overfeed the kittens, they can actually get diarrhea, so I don't wanna overfeed him. So I'm gonna pop him back to bed after that 15 mils. So things I am doing with this kitten, because he's not latching, is I'm gently turning the bottle to find, I call it the sweet spot, because there's 4 cuts in the nipple, one down each side. So a different side might have a different flow, so he might like a different side better. So this kitten has not latched yet. So that's when I'm gently turning it. You can hear him getting angry because he's not latched. And then as he's coming forward, I'm pulling it away from him gently to encourage that strong latch. But this kitten still hasn't latched. So the milk's been sitting out for a while. It might be getting too cold. So I'll put it back in the warmer. I'll put the kitten back in his carrier, and I'm going to grab a toothbrush to brush the kitten, because that might encourage him to eat, because it feels like mom's grooming him. So that's another trick you can use if they won't eat for you. The toothbrushes are kept on the clean area, so I'm going to take off my dirty glove before I grab it. My milk should be a little warmer now. Let's see if that helps. So he's still not eating. Another thing we can try is we can bring out the other buddy that's not eaten yet. So I'm gonna put him in his bucket, and I'm gonna go and get the other kitten, and then hopefully some sibling competition will encourage this one to latch and eat. So now we have both kittens in the bucket together. Let's see if this encourages this little one to want to eat. He's almost latched on, but not quite. So I'm gonna feed the sibling, who is ready to eat. This one was very ready. Ideally, the kitten should be lying down flat when they're eating, but sometimes they will stand up on the edge of these buckets. As long as they're older, that's okay. Tiny kittens do not have a gag reflex. That's kittens under about 2 weeks old. These guys are about 3 weeks old, so that's less of a concern for them. So that kitten only had a couple of meals, about 3 meals. We'll see if our little black and white friend wants to eat any more. So he's backing away from it. He doesn't really seem interested. So I'll try a couple more times, and if he doesn't eat, I would just write not interested in the folder, and then I'll explain what we do if the kitten doesn't eat twice in a row. This one didn't have any of this yet. So while this kitten is eating, I'm gonna push the food back up under where the kitten is, because when they smush it out and it's flat, they often don't think it's there anymore, so we use the little tongue depressor to keep pushing it back into the middle to encourage them to eat more. I'll try one more starter bite. Is that all? Want more of this? So this kitten's being fussy now. Had some bites of food. Had about 3 meals of milk. That's not a whole lot for a kitten of this size, but this one ate about 11 meals earlier, so I'm not too worried if this kitten doesn't want any more. You can see another messy face. That will clean. Do you want some? And it's important to remember, I did not stimulate this kitten yet. So when you get multiple out at the same time, it's hard to keep track of. So if you're new, we suggest you only have 1 kitten out at a time, so you don't forget things like that. So you can see that this urine is a little bit darker. So this would be yellow urine as opposed to the light yellow urine we saw earlier. And that little guy still doesn't want to eat, so we're just going to clean him up. and put him back to bed. He's not acting frantic or starving. He's not acting lethargic, which would be another concern. He looks good. He could be eating dry food, so those are all considerations to take into account before you put a kitten back. So when you're done feeding your kittens, everything that they have touched in this area is considered dirty. So we can't use this food for anyone else, so it's gonna go in the trash. If the kittens were eating it better, I could put it in their kennel with them, but they're not, so I'm just gonna throw this away. The bottle goes into the dirty bottle bin, which is always in the center of the table. So in this section, it's a green bin, and in quarantine A, it's a clear bin. My pillowcase is gonna go in the laundry. If it had anything caked on here like food, I would shake it over the trash can first, but these guys were pretty clean, so this is gonna go right in the laundry basket. And then we're left with our station with our dirty pen, and we wanna make sure we disinfect this. So I have dirty gloves. I'm gonna take off my right glove, and I'm gonna grab the disinfectant and spray this area down. I'm gonna make sure that I disinfect all areas of my pen and also under the mat right there, and make sure everything I just touched is sprayed down again. And that has to sit for at least 1 minute before new kittens come out. So I have my dirty glove in the trash. Make sure you don't throw away the glove you wrote on if you do choose to write on your glove. I'm right-handed, so I'm gonna record with my right hand while I read off my left hand. So over on our recording table, notice that the folder is away from the feeding table. We don't want the kittens walking all over it with their dirty paws, so it's kept over here. The pen I have is a different pen. It's a clean pen that has not been around the kittens. I'm going to write the time that the kittens were fed, and that can be any time in the window that you fed them, my initials, and what they ate. So if you're a volunteer, you're going to want to write your initials and VOL next to it, which stands for volunteer. So we started feeding about 3 p.m. It's now 3:30, so I'm going to say 3:15. My initials are JN. I don't know who I fed when, but I did write down their descriptions. So I know that the brown tabby with the white is the one that had bites of the food. So this one had 3 meals and bites. This was the one that had yellow urine, so I'm going to circle Y for yellow. None of them had stool in their kennel, so I'm not going to circle anything in the bowel movement column. If you're curious about what the letters stand for, they're N for normal, SF for soft formed, SU for soft unformed, and L for liquid. And if you can't remember that, it's right down on the bottom of the sheet in a key. And then I'm going to go ahead and write what all the other kittens ate as well. So for the kitten that did not eat anything, I wrote NI and NI. If this kitten does not eat again at the next feeding, the caregivers are going to go ahead and they're going to give fluids and they're going to give dextrose to this kitten. As a volunteer, you would not be expected to do this, but the charts to indicate how much the caregivers are going to give are up here on the refrigerator in each section. I'm now done with my dirty gloves, so I can take it off and throw it in the trash can. Now I have 2 clean hands. I can use them both. So my clean pen is going to stay over here. My feeding sheet goes in here. And since this was a transitional kitten and this folder is complete, it is going to go back in the main bin in the tab that says Transitional, and it's going to go at the back right here. And then anytime there's a next letter that's due, they're going to be in the bin at the front.